Hey 302, it's Jackie Ferris. On this week's show, we've got babies, ambassadors, and vegetables. They're all good for you. It's a healthy new you on the 302. Hey 302, it's Jackie Ferris. One of the coolest things about any community is how it takes care of its members. We're here at Christiana Care to talk a little bit about some of the programs that Christiana Care has to do just that, and I'm joined by Erin Booker. She is the head of community health. So first of all, welcome to the 302.
Thank you.
So you have a variety of programs that involving ambassadors, you take care of moms, you take care of the underserved. Talk to me a little bit, I guess an overview of what your community health program is like.
Absolutely. So at Christiana Care, we believe incredibly strongly in the importance of connecting with our community, making sure we're taking care of those who are underserved so that everyone can come in our doors and be treated with the exact same care and the confidence in our community. So the things that we do are extraordinary. I have an amazing team. Quite frankly, I am the lucky one who gets to represent them, but they do incredible work. So they are out there doing things like our Health Ambassadors program, which targets at-risk moms to really make sure we're giving them all of the education to be successful in this new exciting adventure of becoming a mom. So we teach them about safe sleep. We teach them about breastfeeding. If they need anything, we're there to give it. So we give out pack and plays, we give out car seats, diapers, really anything they need. We want to make sure we're supporting them so that they and their babies are thriving. And that's just like one of the incredible programs that we have. We also do things like support community programs. So we support a program called Corner to Corner, which is this awesome program where we ensure that kids are walking safely to school. So this program is in a really high needs area with an elementary school, and their bus pattern changed. So more kids had to walk, and they just didn't feel safe, and they would get to school anxious and overwhelmed, and that is not the way they can learn. So we helped support a community organization to put together this program, and now we have veterans standing on the corners to just usher the kids to school safely and sometimes walk them all the way to their front doors at the end of the day, just to make sure they start their day and end their day feeling that someone cares about them, that their community has their back, and that they're safe. And it's just an awesome thing to watch.
Sure. Now you have instances where you support an effort financially, or one where you'll have feet on the street.
Absolutely. So we really have a unique opportunity at Christiana Care to not only provide really amazing programming, but also to see all of the great programming that already exists and awesome organizations who are out there making a difference with their boots on the ground. But really, maybe finances are a little bit of a struggle, so we're able to support them to increase the work that they can do. So they touch more people and help more people because we're able to do that. So it's really about strategic partnerships, really impacting change together, because that's how we serve our community. And our community works for us, our community gets treated by us, and we want to make sure that everyone has great care.
You were talking a little earlier before we started our interview about a program you have that deals with at-risk kids, and you have several generations by this point.
Yeah, so we have a program called Camp Fresh that has been going on for over 10 years now. So now we're starting to see kids of our first ever kids, and it's so cool, and it works with at-risk kids from Wilmington, and it gives them a space to learn and grow both emotionally and educationally. So during the summer they spend the whole day with us, almost the entire week, and we teach them about making safe choices, how to have respect for themselves and any partner they might have, reproductive health. We talk about emotional health and mental health. We talk about how to eat to fuel your body in a healthy way, but we also do really fun stuff. Like I got to go one day and they were doing a drum circle. So just really exposing them to these unique opportunities that they wouldn't have. And then all year long, we stay connected with them. We do family dinner nights where their families come. And I will say that I think it's one of my team's favorite things to do because it's so rewarding to see the joy that the kids have and the accomplishment they feel after they've completed these different education sessions and they do projects. It's just really exciting.
So when you look at all of these programs, they are rewarding, but do you, have you been able to quantify, the result, the ripple effect throughout the community? Why is it important to have this kind of outreach?
Yeah. So we are working on quantifying. It's a complicated thing to figure out how does being in the community impact the community. But what I can say is without question, it builds trust in our community. And without trust, they're not coming in to get treatment. So if we can really show them that we care about their whole self, we care about what's going on in their homes, what's going on in their workplace, and we're bringing treatment out to them, we know that impacts health far more than the 20% that happens within the walls of the health system. So research is very clear, 80% of impact of health happens in the community. So that's why it's so important that we're out there.
Excellent. Now I know the folks at home are going to want to know where they can get more information. So is there a website?
Absolutely. So it's www.christianacare.org/community-health.
Excellent. Well, thank you so much, Erin, for joining us.
So nice to meet you.
Nice to meet you as well. And we'll be right back.
I'm Carrie at the Rockwood Museum, and we're keeping history alive here in the 302.
Welcome back. They say you are what you eat, and if you eat healthy food, then you're going to be healthier. Well, there's a program here in Wilmington put together by Christiana Care and Urban Acres to help people who really need vegetables and fruits get them. I'm joined now by Carla with Christiana Care and Mike from Urban Acres. Thank you very much for joining us.
Thank you for having us.
Carla, tell us a little bit about how Produce RX works.
Sure. So a couple of years ago, we partnered with Mike and Urban Acres to ensure that our patients were having great access to healthy fruit and vegetables. Instead of using, the corner stores for some of the more starchy foods, we know that health happens outside of the hospital. Mike is one of those partners that we partner with to provide our patients with that access.
Now, Mike, talk to us a little bit about the need.
Well, we know that there's food deserts around the city, so we decided that we would have a mobile produce stand, take it out into the communities where the people can have access to fresh produce. And then as we partnered with Christiana Care, we then set up here at the hospital. We set up at both hospitals and just continue to provide the access to healthy foods to the community.
Now, it started out with one location, and now there are multiple, is that right?
Well, Urban Acres started out with one location about 9 years ago, and in a food desert on the east side of Wilmington. And from there we expanded, and now we have about 8 locations that we service around the city.
That's amazing. That's amazing. And of course, having healthy food is so much better than having to take a pill or go to a doctor.
Correct, right. So like you said, what you put inside your body is what defines your health. So we're hoping that our patients, we're focusing on 3 different populations: high-risk pregnant women, our community members, and then primary care chronic disease patients. So we're hoping that their blood sugar gets normalized, that their A1C lowers, that the pregnant women, and their blood pressure goes down by eating from one of Mike's stands.
So how exactly does the process work? How do you identify, and how do they go through the process?
Sure. So we have criteria for each of those groups in order to evaluate our intervention. We give them $10 vouchers, so a total of $100 over the summer that they can use at any one of those 8 stands that Mike talked about. And then they keep engaged with our community health programs. We talk to them about recipes that they can do with some of the fruit and vegetables they buy. They learn about the My Plate and how to portion control. So there's a lot more than just a voucher. Giving someone a voucher doesn't get you anywhere, right? You have to educate and tell them why you're doing this.
And hopefully build lifelong habits.
Correct.
It's so easy to go for the chips or whatever. And
correct. It's easy. It's cheap. Most, like Mike and his team do a great job at making it affordable for our population.
Now, Mike, let's talk about the cost. How much does it cost for folks?
Well, it costs various costs. One of the things we do is that we try to make sure that we have access to healthy foods all year. So it's not just when farmers have it, you can have it local. So when we have to buy it during the winter months, because we still need to make it accessible, then the price varies from point to point as it goes up. So, right now we're having some struggle with heat and rain, and so even the local prices are not coming to where they should be. But by partnering with Christiana Care makes it where we can still keep the prices affordable for people who really need to have this access.
But talk to me a little bit about if somebody sees this and they want to donate. I mean, you probably would accept donations, I would imagine.
I would imagine we'd accept donations.
Talk a little bit about, the tie-in with the church and if somebody wants to help, what they can do.
Okay. We have a team and we need to be pretty consistent. So we look for donations that people can give basically through money or through time that they could volunteer to come to a stand. So anything that someone wanted to do to help out in the community, we started the whole process out with volunteers. Everybody volunteered. So, we've been able to, in order to be consistent though, you need to have paid staff so that you know that they're going to come every day. They get familiar with their customers, and it's all about building relationships, So if people see the same people come back every week, it just feels you more at ease, and you can start talking to people more because it's more about relationships than it is about selling tomatoes. People have to trust you when you say, okay, you need to do this or you need to do that. People need to trust you. It's not just about so we can make money and sell something. It's about people's health, because the more healthier people are, the more healthy community that we have. So it's way beyond just tomatoes and price.
So if there's someone who wants to reach out and they want to get involved, they want to find out more about the program, where do they go?
They could go to our website. Our website is centralbaptistcdc.org. And there we have all of our 3 legs that we have for our whole Community Development Corporation, and Urban Acres is a part of that.
Excellent. Mike, thank you so much for joining us.
Thank you.
Carla, thank you. We appreciate it. And we'll be right back.
Hi, my name is Bob, and I'm the Artistic Director at the Candlelight Theater, and we are center stage on the 302.
Becoming a new dad is no easy task, and there's a lot of anxiety, but there's a new program that's been in place for about 3 years here at Christiana Care that can kind of help you navigate the perils, as it were, of fatherhood. And I'm joined now by Nicole Fernakis. She is a community health research coordinator. Nicole, thank you very much for joining us. How did you guys come up with the idea for a baby boot camp that involves dads?
So in 2016, we had a meeting through our Wilmington Consortium. Wilmington Consortium is made up of maternal and child health community stakeholders that have a real passion around improving the lives of women and children in Delaware. So during a meeting in 2016, there was a lot of concern that there are not enough resources for fathers and fathers-to-be. So it was actually proposed by Dr. Michael Anderson, who is an OBGYN from Westside Health. She's also an affiliate of Christiana Care. And she had actually went through and witnessed a boot camp for new dads program in Virginia and brought it to the Wilmington Consortium. And so since 2016, by the end of the year, Christiana Care funded the program and we rolled it out. And it's been a great success so far.
I know that growing up, a lot of, not all, but a lot of little girls played with dolls, and boys don't tend to do that. So there's nothing from an early age that teaches you, this is how you hold a baby, or this is how you diaper a baby. So I would imagine that there's a lot of anxiety for guys. What are you hearing whenever they come into the boot camp, their concerns, their questions, or feelings about this?
I mean, actually, since I handle a lot of the evaluation of our programs, a lot of the comments are things like, you know, they felt like babies are made of glass. So they're anxious about holding a baby and how to deal with a crying baby. They're kind of, you know, lost in what they do. When they hear a baby start crying, they don't know what to do about it. So I think this boot camp gives them that relief to be able to talk about their concerns and to, you know, have that one-on-one interaction with the other dads about what they've gone through and have that support.
So how does it work? You sign up, and is it a group led by guys, for guys? How does it work?
So there's two components to it. There's a coach who actually provides the education component. So they talk about safe sleep, breastfeeding support, that partner support that you know, that you would have with the mom to be, and there's also talk about postpartum and what the signs are of postpartum depression, how to deal with a crying baby, shaken baby syndrome, sudden infant death syndrome. So there's the education component. So we have the coach there that talks about all of those pieces with them. But I think what makes the program unique is there's also a component of veteran dads that are there, dads who recently just had a baby who went through the experience. So I think what makes it so unique is that they have that one-on-one interaction to be able to talk about, you know, what it is that they just went through, answer any questions. And I think what's also nice with the program is that it's only men in the room. So it should be no surprise that men are more comfortable sometimes talking to other men. It's that locker room talk. So just being able to talk about, you know, not have the intimidation of the mother right there or ask any stupid questions that are something that would make them anxious or embarrassed to ask about. It's that men-to-men talk.
Sure.
So those are the two, you know, major components of the program, the education and then the interpersonal relationship.
So 3 years, you guys have been really successful with this. About how many dads do you think you've cycled through? And do you have any data? I mean, do you follow up with these dads or?
Yeah, so I don't know the exact number of how many dads. I would say it's definitely around 70, 75 dads that have gone through the program, and it's a mix of veteran dads and new dads. So, you know, it started off slow in 2016 when we started it, but once we marketed it, you know, it really picked up. And some of the data that we look at pre and post stress and confidence around being a dad. So we found that, you know, the stress is generally higher, the confidence is lower, and then after, you know, they go through the workshop, we find that stress is definitely reduced and their confidence is definitely increased. We do follow-ups to see for the dads to be if they want to participate as a veteran dad, so that they can, you know, having gone through the angst and anxiety of it before and then go through, you know, what they went through and, you know, help empower those dads to be in the workshop.
Because when you empower them, if you empower the fathers and you empower the mothers, I mean, the end game is going to be a healthier, happier baby, right?
Yeah. Yes, exactly. So my husband and I actually just went through it, and you know, that was really a great experience for both of us. I think the one takeaway from my husband is that he now understands what mommy brain is like. That's something that they teach you, and you know, the emotions that the mother goes through after having the baby. And you know, I was surprised to see how, you know, emotional and ups and downs you have after having a baby. But having taken this program, I was prepared for dealing with those emotions, and my husband was too. So I think that was the big takeaway for us, is having that partner support.
I think it's probably, you know, really good. People see, you know, you're, you know, head of the program, and so you're walking the walk, you know, because now it's not just the daddy program, there's the mommy program that has expanded from all of this.
Yeah, so we received some feedback after, you know, several dads having gone through it. You know, my wife or my partner would really like to go through something like this. Do you guys offer it for moms as well? So that kind of, you know, was a trigger for us to start it for moms as well. And there's lots of programs out there, you know, that handle, you know, CPR and infant and children training. There's also, you know, how to change a diaper, programs around preparing for labor and delivery. So it was really nice to have this program that's more about the conversation piece and how to kind of get through the anxiety of being a new parent.
Now, if someone wants to take the mommy or daddy boot camp, where do they go? What do they do?
So you can actually call and just speak to one of our coaches, and they can actually schedule you for any of our workshops. We run our workshops between 4 to 6 times a year. So, you know, anyone is welcome to attend the workshop as long as they're expecting.
All right, Nicole, thank you very much for joining us. And we'll be right back. For more information on community health programs here at Christiana Care, you can go to christianacare.org. That'll do it for this episode of the 302. We'll see you next time. Take care.